Hi, my name is Abillio Fon. I'm a final year student at LECOM School of Pharmacy. Today I will be presenting on pulmonology, differential diagnosis for cough in adults. These are my objectives. By the end of this presentation, you should be able to describe the three categories of cough based on duration. List the most common causes of chronic cough in adults. Describe an approach to diagnosis and treatment options for patients presenting with cough. List some symptoms associated with life-threatening conditions. Cough is one of the most common symptoms for which people seek outpatient care. Cough happens when cough reflexes are triggered, causing a reflex arc to be stimulated. Cough reflexes are mostly found in the upper and lower respiratory tract. Cough is normally a protective mechanism that clears the airways and the lungs of excessive secretions and unwanted particles, but it can also lead to complications that cause people to seek medical help. In this presentation, we'll be focusing briefly on the management of the most common causes of cough in adults. There are three categories of cough depending on how long the patient has had the cough. They can be acute cough, subacute cough, or chronic cough. Now, acute cough is cough that usually lasts less than 3 weeks and is mostly associated with acute upper respiratory tract infection. Subacute cough is cough that lasts between 3 weeks and 8 weeks and is mostly due to post-infection. Chronic cough is cough that lasts more than 8 weeks and is mostly associated with upper airway cough syndrome, asthma, or gastroesophageal reflux disease. Now let's look at some of the common causes of cough. The most common causes of cough include upper airway cough syndrome, asthma, gastroesophageal reflux disease. Cough can also be caused by exposure to environmental factors such as medications and irritants. Smoking is one of the main causes of cough as well. And for medications, the most important class of medication as far as causing cough is concerned is classes of drugs called ACE inhibitors, which are used for blood pressure. There are other causes of cough, but they are often associated with one of these or a combination of these. Now for diagnosis and treatment options, the first step in diagnosis is to determine the history and physical exam of the patient. In determining the history, we're mainly looking for duration, whether it is acute, subacute, or chronic cough. If the patient has had the cough for more than 8 weeks, then we know it is chronic cough and needs treatment. We can also look at the physical exam of the patient by taking the chest x-ray. And chest x-ray can either show normal results or abnormal results. So if we have normal results of chest x-ray, then we know the cough can either be caused by upper airway cough syndrome, asthma, gastroesophageal reflux disease. It could also be from post-infection, or it could be from environmental exposure or exposure to medications. Now, if the chest x-ray show abnormal results, then the patient will require a specialist, as diagnosis in this situation will depend on specific findings from the chest imaging. So the first and most common cause of chronic cough that we talked about is upper airway cough syndrome. Upper airway cough syndrome, often called postnasal drips, are secretions that drain into the throat and trigger cough and congestion. These secretions are mostly from the nose or sinuses. Upper airway cough syndrome is usually caused by upper respiratory tract infection, allergic rhinitis, and it could also be caused by acute sinusitis. The most common symptoms include runny nose, feeling of liquid dripping behind the throat, and frequent clearing of the throat. Treatment options often include first-generation antihistamines and decongestants. Our next condition for chronic cough is asthma. Asthma is one of the leading causes of chronic cough in adults and in children as well. Patients with asthma often present with cough that is accompanied by wheezing and shortness of breath. Asthma is also associated with genetic factors. That's why a family history of the disease is often a considerable diagnostic factor. Asthma can be diagnosed by challenging the patient with beta agonists or another medication. Asthma is usually treated with beta agonists alone or in combination with inhaled steroids. So the patient can either take a combination of beta agonists and inhaled steroids, or beta agonists in combination with inhaled steroid and oral steroids. Our third most common cause of chronic cough that we talked about was gastroesophageal reflux disease. Patients with cough associated with gastroesophageal reflux disease often present with heartburn and other respiratory symptoms such as runny nose and a sore throat. Aspiration of gastric content is often also seen in patients presenting with these conditions. This is usually associated with the stimulation of cough receptors in the upper respiratory tract, stimulation of receptors in the lower respiratory tract. This is because of the aspiration of gastric content that passes through these areas. Symptoms often worsen in patients when they lie down. Diagnosis of gastroesophageal reflux disease associated chronic cough is usually done by taking the esophageal pH of the patient. And the treatment options include lifestyle modification such as weight loss and diet that does not cause acid reflux. Patient can also be prescribed medications such as proton pump inhibitors to control the acid reflux. Other causes of cough involve post-infectious cough and environmental factors. Now, cough that is resulting from post-infection is usually a situation where a patient develops like an upper respiratory tract infection, and then when the infection clears, the cough lingers with the patient. Patients presenting with post-infectious cough often have signs and symptoms of upper respiratory tract infection. And treatment options often include antibiotic if it is determined that the infection is caused by a bacteria, and this can be determined using sputum culture. There is also environmental factors. So, in determining this, if this is a cause of the cough, we often ask if the patient is on ACE inhibitors, or if the patient smokes, or if the patient is exposed to any other medication that might cause cough. And the treatment in this one is usually just to discontinue the medication or to adjust the dose if it cannot be discontinued. Now, if the medication cannot be discontinued, the patient can also be put on another medication to control the cough. Now, we have talked about the most common causes of cough, and we have seen some signs and symptoms that accompany patients presenting with such conditions. There are also some symptoms that show in some patients that are considered red flags because they are an indication of a more life-threatening underlying condition that will need to be evaluated and treated immediately. Some of such symptoms include hemoptysis, which is cough that comes with blood. So if a patient presents with cough that is accompanied by blood, then that needs to be taken seriously. And we also said smoking is one of the main cause of chronic cough. So if we have a smoker who is above 45 years old and develops new cough or has a change in an existing cough that they have, or if the patient has cough that alters their voice pattern, then their cough needs to be treated seriously. If we also have an elderly patient with a history of smoking 30 packs of cigarettes a year, even if the patient has quit smoking within the past 15 years and develops cough, then we also need to take the cough seriously. We also have patients that present with difficulty breathing while at rest. If they also develop cough, then that can be an indication of a more serious condition. So patients that have cough and present with fever is also a serious situation. If we also have patients that cough and develop weight loss, we have patients with peripheral edema and weight gain. If they present with cough, then that can be an indication of a more serious underlying condition. We also have trouble swallowing, vomiting, recurrent pneumonia, as pneumonia that goes and then comes back within a couple of months. And then we said if we have abnormal chest imaging, then that can be an indication of a more serious situation. So if a patient presents with any of these symptoms, then the patient needs to be evaluated and treated as soon as possible. To summarize, we have seen that the first step in evaluating a patient presenting with cough is to perform history and physical examination to determine the presence of other underlying causes. We also saw that cough can be acute, subacute, or chronic depending on duration. We also saw that the most common cause of cough include upper airway cough syndrome, asthma, or gastroesophageal reflux disease. And we said a proper diagnosis of cough can lead to better treatment option and a better quality of life for the patient. Okay, this is the end of my presentation. Thank you for listening and goodbye.